Oh ya, silakan dari Rumah Sakit Soeradji. Mic-nya mohon di-unmute dulu, karena tidak terdengar suaranya. Unmute dulu. Ya, silakan.
Hello. Okay.
Ya.
Thank you. My name is Dijantoso from Soeradji Tirtonegoro Hospital, Central Java, Indonesia. My question is simple about the hospital internal system. How about the hospital internal system in the United States to protect itself from allegation of fraud? And the second is, would you give us an example of hospital internal system in the USA? Thank you. Hello.
Okay, so the first question was how do hospitals protect themselves from fraud?
Yes.
Is that the question?
Yes.
Okay, I can take that one. They have a compliance officer. Every hospital has to have a compliance officer, just like the insurance companies do. And they have to give oversight to ensure that that hospital is not getting overpaid for any procedure, that they're not breaking any laws, that they're not causing any patient harm. Their whole job is to oversee that hospital and make sure they're in compliance with the government, the private carriers, and all the medical boards. So that's pretty much the go-to person in each hospital. It's a hard job. It's not easy, but they do have that officer who gives oversight. Does that answer it a little bit?
Yes, the second question about will you give us some example of hospital internal system to protect from fraud? Something like standard operational procedure on etc.
So do you want to hear about types of fraud in the hospital? The kind of fraud we see in the... Yes?
Yes, something like standard procedure, standard operation procedure and so on.
Okay, so the different types of fraud that we see, they will often bill for expensive pharmaceuticals that they never dose, or they'll bill, let's say someone goes in for breast cancer and the common pharmaceutical is Herceptin. Have you heard of Herceptin? So what they will do is they will bill for an entire vial of the medicine, but they'll split it between 3 breast cancer patients, and it's very, very expensive. So we end up paying for an entire vial when they only used 1/3 of the vial for our member. So that's a treatment that was never provided, or treatment services not rendered because they overbilled for it. Another common issue in the hospital is spinal surgeries. If people go in to have a spinal surgery and they have some vertebrae fused, oftentimes we will get billed for more implants than are placed in the spine. Some of these clavicle screws and pentacle screws are $5,000 each because they're titanium. So the hospital may bill for 10 of them, but they only use 2 screws in the spine. Does that make sense? Other things, they will admit the person when they probably should be kept on observation, but they admit them because they want to, you know, make more revenue. Other types of fraud, they will cause patient harm, and not only do they cause harm, but they will cause the patient to spend much more time in the hospital because they've acquired a hospital-acquired infection. We see this pretty regularly, unfortunately. They'll go in for a knee replacement, and they'll get a nosocomial infection in the hospital, and they'll end up staying for 3 weeks, and sometimes in intensive care. And times it's because of poor hygiene in the hospital. Right now, the U.S. government has made laws that they will not pay for these hospital errors or mistakes. And private payers will not do the same thing. For example, if someone goes in to have their right foot amputated and the doctor makes a mistake and takes off the left foot, terrible mistake. It causes more time in the hospital. They haven't fixed the issue. They have to take off the other foot. This is called an event, a never event, and we have now legislation that we will not cover the malpractice errors of a hospital or a physician. So things like that. We don't want to have to pay for damage that's caused by malpractice in a hospital. So that's a big issue now. And then there are also issues where they will discharge a patient too early, knowing that they'll have to be readmitted. And if they discharge them and then readmit them, they get a whole new DRG. So there's all these schemes with hospitals, and the biggest one, of course, are the kickback schemes where the doctors are paid to refer more patients from the ER into the inpatient hospital.